Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Friday, May 15th. Please stay to the end. We have something special, Fred, at the end.
Very special message.
All right. Let's begin with the numbers from the 8 counties. On the graph, you can see represented there that in the 8 counties of the capital region, we currently have 110 people who are in hospital beds being treated for COVID-19. That is down from the day before when it was 118. For ICUs, we currently have 28, which is down from 31. I would let you know that the numbers that you're looking at are numbers from Wednesday, so they lag by a couple days, but it is an improvement, a decrease from the day before, from that Tuesday. And Fred, there was an article today in the paper.
Yeah, there was an article in the Times-Union, it's actually on the front page, Dennis, that describes how the state is grabbing this data and putting it together. It's worth a read.
And if you're interested as well, you can go out on a search engine on the internet and you can look up the criteria that they use to determine this. Inside here in the medical center, where we were yesterday as well, we currently have 47 in the hospital, we have 37 on the floor, we have 10 in ICUs, and we have 6 on ventilators. And speaking of the ICUs, I'm wearing blue today, and Fred, you're also wearing blue.
Couldn't decide which color blue, so I have 3 different colors on.
It is National Critical Care Awareness Day, and they ask people to wear blue in honor of the people who work in our critical cares.
That's right.
The critical cares have been on the front line of this from the very beginning. Physicians, nurses, respiratory therapists, pharmacists, social workers, everybody, but it's all in the critical care environment, and we're so proud of them.
They've done a terrific job caring for these patients.
I want to talk a little bit about masks. It has come up a couple times. People will say to us, we watch your videos, we enjoy your videos. Why are you not wearing masks in your videos? And we've talked about the fact that this is not a public space. We can socially isolate from each other. We check our temperatures, we do symptom monitoring.
That's right.
Fred, we spend a lot of time in meetings together. We're often separated from each other.
Absolutely, we spread out, definitely.
However, the hospital is getting busier. And so some of the areas that we travel in are getting more crowded, such as the cafeteria. And in point of fact, it's sometimes harder now to keep that 6 feet. So I think going forward, we've talked about that there's going to be a need to wear masks more often in that location as well.
And so you'll be seeing both of us wearing masks periodically when we can't socially distance.
And we have to be careful because masks are something that we're trying to be very careful stewards of as well.
That's right.
But we and others will be using them as the hospital gets more crowded when we can't socially isolate.
Yes.
So I'm glad that people brought that question to us so we could
great.
talk about that. We also want to talk about the update on the process of doing the medically necessary procedures and the status not only at the South Clinical campus but other locations.
So South Clinical opened this week.
Yes.
We've actually had a very good week. Really nothing, no problems in terms of getting started there. We're going to start opening up next week other sites. So our endoscopy suite on the 4th floor of the A building will open up on Wednesday. So we'll start doing some of the simple screening colonoscopies and other procedures there. The following Tuesday, so the Tuesday after Memorial Day, we'll open up Niskayuna. And we're going to open up Niskayuna a little slowly, so probably 2 rooms for the first couple of weeks to get started there. And we're also going to expand our capacity in the main OR to 27 rooms. Now we have 35, so that's still well below our capacity, but we think that's a pretty good start. Most importantly, on May 30th, a Saturday, we're going to start doing cases at South Clinical.
Excellent.
And that's going to be a go-forward change for both South Clinical, the main campus ultimately, and Niskayuna. We're going to use our facilities 6 days a week. So more to come on this next week, Dennis.
It's great. Thank you, Fred. And this is great for our patients in the community as well. So thank you for that.
It's really convenient for people to come on a Saturday and not take a day off from work.
Absolutely. Albany Medical Center is an academic institution. We have 3 missions. It's clinical, it's education, and it's research. And we're proud to talk about some research that's currently taking place on this campus. Dr. Ariel Jadovich, who is in the Department of Molecular and Cellular Physiology. And he's doing some groundbreaking research. His professor, Dr. Harold Singer, has talked about it. He called it pioneering and breakthrough research. Fred, he's looking at why some people are more likely to have the serious side effects of COVID-19 versus others?
As we've talked about, Dennis, there are people who are completely asymptomatic all the way through people who are so critically ill that they need to go on heart and lung bypass. So he's trying to understand genetically what the differences might be in all the different outcomes.
It's
very important.
Yes, it's important, it's ambitious, and he's partnering with the University of Wisconsin. So we thank him and that whole department for that research. I'm sure we'll have more about that in the future. Antibody testing. There are 3 different areas where antibody testing is going to be done. Let's start with the first one. On an outpatient setting, in the future, there's going to be the ability for people to get antibody testing. We're not doing that yet. We're going to put that aside for the second. Research. You've talked about this, Fred. The IRB, I understand, has approved the protocol. The principal investigator is Dr. Mike Waxman. Many others were involved as well, and I think that should be starting next week.
That's going to start next week, so a messenger will go out asking for volunteers. They'll randomly select and start doing the testing.
Dr. Chang, Dr. Teleski, Megan Wygant, the lab, a lot of people involved in this. This will be great.
A lot of hard work to get this together.
Then we have patients in the hospital that need testing for COVID-19, and we now have the ability for our providers to order it in an electronic order for COVID-19, but there are criteria by which they have to order it.
That's right, Dennis.
So it's in our Sorian system. 2 of the conditions that you might need to order it in is if you thought the person had a post-viral inflammatory syndrome, sort of like the pediatric one we spoke about.
The children we've been talking about, yep.
Also, if you're going to be a recipient of plasma, we would probably need to check you before and after as well. And there's 2 other conditions.
And so if you're an immunocompromised patient or potentially going to become one, like a transplant candidate, that's a 3rd category for testing. And then the last category are congregate living patients. So people who've come from group homes or from nursing homes where there's been a pretty high level of exposure. That's another reason for testing for the antibodies.
So the antibodies. And let's talk about that. So if you test positive for the antibodies, that talks about exposure, but it does not mean immunity.
Yeah. We don't know right now that
not
it
yet,
means
anyway.
Immunity. We think it would,
yes.
But that's to be shown yet.
And if you don't show presence of the antibody, that also says something.
Depends on timing. So if it's less than 21 days since your infection started, it may mean nothing. You just haven't mounted a response yet. If you're beyond that period of time, then perhaps you didn't really have COVID.
All right, so antibody testing available in our electronic medical record for providers to order, and that's live now, I believe.
It is.
All right.
Yes.
So we call this Good News Friday.
Yes.
And I believe, Fred, why don't you tell the story here, because this came to you first.
So lots of people watch this video. I've had calls from old patients down in Florida, friends out on the West Coast. My son in Australia, probably the furthest one away, watches this. And 2 very special people have been watching us, I think, from the beginning.
Yes.
Daniil and Yesenia. And they're so fascinated by this that they've chosen to do their own
video.
I
think they do it every day.
They do it every day. First they watch us so that they know what to put in their video, and then they do their video. So we thought we'd share a little clip of them.
All right, let's watch them right now.
Hi, I am Dr. Dennis McKenna, and as usual, I am joined by Dr. Venditti, our hospital general director. And today is the mission command update, COVID-19 patients. So in the late days, we have 80 patients that have confirmed to positive coronavirus or COVID-19, which 42 are on the floors and 38 are in the ICU, which 36 are on ventilators. And Dr. Venditti, do you have any questions? Do we have enough masks? So Dr. Venditti said that we have plenty of masks.
Well, I think you'll agree with me. That was fantastic. Thank you, Daniil and Yesenia. I think they have a bright future, Fred.
I think so. In medicine or media, I'm not sure which.
Yeah. And if they have other videos, we encourage them to send them our way. So we hope that puts you in a good mood. It is Friday, and we're going into the weekend. It should be a beautiful weekend.
Yes.
We hope you can enjoy it. Our staff will be here working 24/7 as always, and we'll be back again on Monday with another video. We ask that you please take care of yourself, take care of each other, and we'll see you Monday.